After I got my license, I started my practice, and back then no naturopath in BC were doing any IV therapy. They were too scared. They don't know what chelation therapy was. They're not even ordering any lab tests simply because the MDs in the province will not honor their order at all, And basically, MDs won't even talk to naturopaths. And it's interesting because of my background. Right now, my clinic actually has 2 hyperbaric oxygen chambers. I have my own X-ray. We have 2 sets of diagnostic ultrasound in place, even though not used a lot because we're not having these things for the sake of doing them, but for the sake of tracking how patients are doing. If the system would pay for an ultrasound, I'll read the report or look at the films. That's ordered by the medical doctor. There's no problem. We actually have our own lab, our own laboratory that would do not only blood counts, look at the immune system, do the regular liver function test, kidney function test. We would do also a lot of a little bit more sophisticated tests such as tumor markers, we are one of the first labs in Canada that would do a free PSA. In fact, we can go into it later, but when you have a total PSA, it's kind of meaningless. You do need the free PSA to tell you a little bit more about what your prostate cells are doing. Anyways, and we also have, of course, I have 2 sets of dark field microscopes, and I certainly don't believe that you can find parasites in dark field microscopes. And of course, I have a bright field microscope, and from time to time, I would even request for the tissue slides to be reviewed because I've been trained by this crazy pathologist in Medicine Hat, Dr. Harris. He's still somewhere in Alberta, and I can't say that I would be qualified to write any pathology report, but I would definitely look at everything very critically, and we also have the softer testing, such as the biological terrain assessment. We have the Heidelberg system to test for stomach acid. With very cautiously, I would order doing electrodermal screening on patients to look for allergies, meridian imbalances, and perhaps sometimes I would desensitize patients against offending substances and compounds. And also we have probably the one and the only infrared scanner that I brought in from China that uses liquid nitrogen to cool down the temperature of the camera case so that we have a very sensitive survey down to a temperature difference of 0.05 degrees Celsius to track the surface temperature so that we can spot check and also compare what's going on in cancer cases as well as other chronic diseases. Of course, we have other contraptions such as the CRT, computerized response tomography. We do our own electrocardiogram. We do our own interpretation of the electrocardiogram as well. We've grown to about 12 staffs now, and there's 6 of my staff. They're actually qualified medical doctors who are not licensed in Canada, and they range all the way from a Filipino lady who used to be an anesthesiologist in the Philippines to a fellow who had worked 10 years as a surgeon from Taiwan. For some strange reason, he's sort of not making as much money and happy to help us out in the clinic. Yes, we do chelation, we do intravenous hydrogen peroxide, We do intravenous Laetrile. We do somatostatin treatment or the octreotide treatment, very similar to Dr. DeBella. We do insulin induction therapy, not so much of hypoglycemic treatment or the potentiation treatment, but we do drop patients' blood sugar level down in the 20 or 30 milligram per deciliter range very safely and carefully. We have a stat lab to monitor patients' sodium, potassium, and blood glucose very quickly, very carefully. And it's a little bit crazy, but we're awfully careful that we actually run 30 IV pumps in the office.